Immediacy is important in any disease process. If you can intervene earlier rather than later in the disease process, where the inflammatory reaction has then gone on, caused scarring and tissue changes and so on, you generally have a greater chance of impacting that disease process. So in traumatic brain injury, there are many things that hyperbaric oxygen, and this has been shown in research going back to the roughly late 60s, early 70s in Germany. And so if you look at traumatic brain injury, it's a wounding condition. And this has been shown. It's primarily in the white matter, the connecting tracts of the brain. So every neuron's like a little tree with branches that receive input and are contacted by other neurons. All of that electricity gets summed up, goes down the cell, and goes out its root, which then branches and touches other neurons. That root is the white matter, or composes the white matter, which are broad tracts of, we can think of it as the cable system of the brain, like, the cable companies. And that's where the injury is. Well, each one of those connecting tracts that's injured is like a little wound. And now with tissue damage, what happens? Plug in the DVD. You've got inflammation there. So very early on, what hyperbaric oxygen is treating as acute concussion is that wound, the inflammation associated with it, the swelling that results from it, and what you're doing is decreasing the swelling, inhibiting inflammation, and stimulating the repair process. And if you can get to it quick enough, I've got to think back. Our first acute concussion patients were back in the early 90s. And they got referred, along with what we were studying, was the application of this to anybody with a neurological problem. And so in the process, acute concussion patients got referred, and it turns out that many of the early patients were my kids, family members, and others who had, sports concussions and all, relatives. But then other patients, along the way. And so early on, you're treating all of this acute pathology in acute concussion, and it just takes a few treatments.